Welcome to the Moulding Health Show. Our goal is to leverage the wisdom and experience of healthcare practitioners to set you on a path of self-discovery and healing. These insights, coupled with a multidisciplinary approach to each area of interest, should provide an invaluable resource to everyone looking for a better approach to health. In this episode, we speak to René Loggerenberg about sensory integration disorder from an occupational therapist point of view.
Welcome to the show today. We're going to be chatting to René Loggerenberg about occupational therapy and sensory integration. Hi, René. Welcome to the show.
Hi, thank you for having me.
Hi, René. So we're going to be talking about sensory integration disorder. I don't think we've ever come across this before. I mean, we came across a lot of sensory integration, but I'm really excited to be able to have this discussion with you. And, we've said it to every one of our guests before this, is that Shaz and I get to learn tons of stuff because, it's, some of these areas of interest, we've never come across. And it's actually interesting to see, specialists like yourself, that deal with that. So maybe, just to kick it off, can you tell us a little bit about what sensory integration disorder is?
Yes, so sensory integration disorder actually occurs without us even thinking about it. It's at the most basic level, it's basically the inefficiency in our central nervous system to process information that we receive from all our sensory systems. So our nervous system organizes the information that we receive from our body through all our various senses, and it processes it in order for us to be able to use that in our day-to-day lives. So difficulties in the processing of information can lead to various other problems, such as disrupted motor coordination, problems with sleeping, eating, learning difficulties, also paying attention and concentration difficulties, and also affect us socially and emotionally. So sensory processing disorder exists when our sensory signals don't get organized into appropriate responses. And as a result, a child's daily routine and activities are disrupted as a result. We do get information from our 7 senses, which is important to note, as most people just know about the basic 5, which is our vision, auditory, touch, smell, and taste. But then there are 2 other senses that we talk about, hidden senses. The one is called the vestibular system, which is located in our middle ear, and it gives us feedback about the movement and balance of our body. Another one of those systems are what we call proprioception. That's the feedback we get from our skin, muscles, and joints, and it tells us where our body is in space. That's basically sensory integration disorder in a nutshell.
Wow, that sounds amazing. And have you always wanted to do this, or how did you even stumble on it? Is this something that naturally happened, or is it that something that you always wanted to specialize in?
Yes, well, I know that I've always wanted to work with children, and if you look at the child's development, it's almost like looking at it as a triangle. At the top of the triangle, we have all our executive functioning skills like reading, writing, concentration, all of those kind of skills. And as we go lower down on that triangle, we look at more of the basic skills. So we go down a little bit lower and we look at things like motor planning abilities, our ability to use the 2 sides of our body together. And then even if we go even further down on that triangle, right at the bottom, we get our sensory systems, which is the foundation for development. And just looking at it at a triangle method like that, it tells us that any developmental difficulties in children are affected by their sensory systems. And that's why I decided to study further in sensory integration, as that's basically the base of all our development and all the difficulties that children experience.
That is incredible. I really like that. So by putting that analogy of a triangle, does it mean that the sensory related stuff is actually as important as that? Is the base of that triangle?
Yes, definitely. It's the most important part of our development. And if there's a difficulty or an immaturity in one of those sensory systems, it is going to affect the top of that triangle. So a child who's got difficulty with that movement system might be sensitive to movement, and they don't get all the exposure to the movement input that's required, and that affects our motor coordination and our ability to plan novel tasks. And that again affects the top of the triangle even further. So really the sensory systems which are at the bottom are really the foundations for development.
Wow. We've actually chatted so much about sensory integration, but I've never heard someone mention it in exactly the same way that you did. I said it in another episode, but the first time I came across sensory integration as a term was sitting in a workshop with Meg Foray in Cape Town. And, she was talking about it, and she was showing these examples of kids, with sensory integration issues. And it was the first, like in my vocabulary, and my wife's a clinical psychologist, but even in her vocabulary, it wasn't even there, and so it was interesting. So I'm really glad, to see like people specializing, so much in this, and also for me to understand how important it is, because as a parent, and I think as people not in the medical, industry, I think it's an unknown topic. I could be wrong, but I don't hear it being spoken about, in other circles. So can you give us some examples? How would we see this? And you said, you specialize in children, but how would you see this? What are the signs or examples that we would actually look at for a child that's struggling with sensory integration?
Okay. Right. So there are many different ways in which sensory integration difficulties can present in children. A child can either be under-responsive or over-responsive to sensory input. So they can either experience the sensory input more intensively than another child would, or they can actually experience the sensory input in a more severe way. So an example would be a child who's over-responsive to tactile input. And a term that we use for that is tactile defensiveness. So the child actually reacts emotionally to touch. They might not like being touched or being cuddled. They've got difficulty standing close to another child in a line. They often complain of the textures or the kind of material of their clothes that's bothering them. They don't like grooming tasks like brushing their teeth. And they often also present as a picky eater. Another example would be a child who's over-responsive to vestibular or that movement input. They would be the ones that really struggles to cope when their feet are not grounded on the floor. They would often prefer sedentary activities instead of going on roller coasters or slides. They're often aware of heights and quite fearful of going up and down equipment. Whereas the opposite of that would be a child who's under-responsive to movement input. And they would present as quite movement seeking. So they would be what you explained as or describe as the Energizer bunny. They would constantly be on the go and seek all kind of movement activities. They would love running around, love going on swings, rock, and also often would be rocking or movement seeking while they're seated. So for each of our sensory systems, there's a different way that it would present. Another one that's often talked about, it's quite a big term that's called dyspraxia, but it's actually just a child having difficulty with planning, organizing, and carrying out new or any unfamiliar activities. So an example of that would be a child who's really finding it difficult to learn a new skill like jumping with a skipping rope, or even things like using a keyboard. They will also present as being clumsy and perhaps struggling to climb stairs or even participate in any novel gross motor tasks. So there's really a very big variety of signs and symptoms that can be observed.
That's so interesting. Shaz, we had someone on the show talking about dyspraxia, but not from an OT perspective. Is that correct?
Yeah, we recently chatted to a speech therapist talking about dyspraxia from a speech therapy point of view, and also very similar along the line of, because it's new, they struggle with learning to say or pronounce words. And obviously, in order to read, you need to be able to pronounce the word to be able to spell out. So it affects from the learning ability, that new skill of learning to talk, which then obviously evolves into the skill of learning to read or write. So it's quite interesting how different professions can very often be treating the same, the same illness or the same
area of interest,
difficulty. Yeah.
Okay. Yeah, I think that's that's the thing I really love about, I mean, the healthcare, practitioners, is that there's always this multidisciplinary approach, especially I find with kids, there's, the OT perspective, then there's a physio perspective, and then the speech therapist perspective, and, the pediatrician maybe, which is actually really nice. It's almost like, like being in a hospital room and all of these professionals around you, trying to diagnose it in a way, and each has their own benefit, around the area of interest, which is incredible for the child, who's struggling with it, which is very, very cool. Yes. Tell me, when you speak about, a sensory integration disorder, is it a disability? I mean, is it, or is it just a classification of something that's happening with the child?
Well, I think we all might have occasional times when we have a difficulty in one of our sensory systems. Research has shown that 1 in every 20 children experience symptoms of sensory processing disorder that are significant enough to affect their ability to participate in everyday life activities. So symptoms of that, like with most other disorders, occur within a broad spectrum of severity. And I think we need to be aware of that while most of us have our occasional difficulties, for children and adults with sensory processing disorder, these difficulties are usually chronic and they can disrupt their everyday life. So in a way, it would be seen as a disability, but it's also important to remember that one can learn strategies and coping ways to be able to cope with that, so it doesn't affect your everyday life in such a severe extent.
That's actually interesting that you say that. So is it, because we had another practitioner as well, when we were speaking about play therapy, and she spoke about, coping mechanisms and, skills that you learn. And then obviously that carries over into teenagers and adulthood and stuff like that. Is it kind of the same thing? So, if you diagnose it early enough and you equip the child with having these skills, that it actually helps them through their life? Yes.
So like I've said before, that people are able to learn coping strategies to cope with the sensory difficulties. It's important also to remember that a child or a person with sensory integration difficulties, it might present differently in each area of their life. So, example, a baby with difficulties might present as a baby who's struggling with feeding or sleeping, or just in general be quite a fussy baby. Whereas in school-age children, it might manifest more as a child who's struggling with planning difficulties or struggling following instructions or with more structured activities. Later in life, it might present as somebody who's avoiding social interaction. They might be somebody who's really sensitive to auditory or visual input, so they would really dislike having to go into a shopping mall. Instead, they would rather do online shopping, which is quite easy in today's time, although it's not a very healthy way of doing things, because that might affect other areas of their development and their functioning, like social skills and emotions as well. So I won't say that it's sensory processing disorder doesn't get worse with age. It's just different in each area of in each phase of our lives.
I actually really like that you say that it doesn't get worse with age, but as you kind of grow up, your sensory inputs might be different based on where you are in life. And what I'm taking from that as well is, if you aren't kind of diagnosed and start learning those coping mechanisms at a young age, as an adult, it could become a lot more detrimental. Like you mentioned, you become almost, if you are sensitive to noise or social interactions, you become almost reclusive by wanting to stay at home and shop online, because you go into sensory overload walking into a shopping mall. So that in itself then obviously causes other issues, which might not be realized that this person could have a sensory issue and start being looked at more as, okay, well, you're just a recluse or antisocial, which causes a whole other knock-on of things. So I really like that, it doesn't get worse with age, but if it's not looked at as in your developmental stages, it could reflect really negatively as you get older.
Yes, exactly. That's why it's important to start with intervention as soon as possible, so that the child from a young age can learn the coping strategies, so that they have the skills later on when they're presenting difficulties change in a way so that they can adapt their coping mechanisms to be able to cope with it better in each phase.
That in your from your experience, how does a child actually show some of that behavior? Obviously, I don't think it's completely antisocial as they're growing up, but do you see certain things kind of happening from a behavior point of view?
Okay, so it definitely affects a child's behavior. It can affect them emotionally, as a child with sensory difficulties will probably be the kind of child that insists on having things their own way. They also thrive on things like routine and predictability. They tend to get overwhelmed easily in an unfamiliar environment. They have difficulty calming down, and they're struggling to self-soothe. So it will also affect their participation in activities. It might affect them socially in a way that they might be the child who's struggling to stand close to another child in the line, and instead of using words or just knowing how to cope with that. So instead of moving away from the child, they would push the child as they're getting too close into their space. So the other child might not be aware of why the child is reacting like that. And the teacher might even just see the child as a naughty child trying to start a fight. So often children with sensory difficulties struggle to make friends, as the other children don't understand their sensory needs as well as they need to.
That is incredible. I mean, in many ways, I love the world that we live in, because it's almost like so understanding, and you can find schools and, that are more geared towards, children with sensory integration difficulties. But, when I was growing up, if someone was reclusive or they were pushing people around, yeah, you're completely right. Parents or teachers would just say, this is a naughty child, and they would get a label and stuff like that. But, and not that it doesn't happen now, I think it still probably does, but I think there is a lot more assistance. I mean, I can't remember, having professionals like yourself that are dealing with this, and that can help a child, through it. But
Yes.
I have to ask though, I mean, so would someone actually, and this is a selfish question because our little boy struggled with it, or still struggles with it, but do they grow out of it? I mean, if you give them these coping skills, or is it that it becomes less pronounced with age?
Not really. I don't think a child or a person can outgrow sensory difficulties. The thing is, they probably just have to learn, again, that coping strategies, and be able to use them effectively. But the sensory difficulties will never go away completely. Things like in the environment might just need to change. But again, that's something that will be addressed in therapy, and according to each child, certain strategies can be put into place that will help them cope throughout their lives.
Yeah. So when we had the other practitioner on that spoke about play therapy, and we joked because, as a child, you can tell them, you can have a timeout and they can go into a closet or something and just stay there for a little bit. But if they're an adult or a teenager, that's going to be a bit weird, so
Yes,
you can't
yeah.
really do that. You almost need to mask it in other ways, but it doesn't go away. You just have to find other ways of almost like blanking it out.
Yes,
Which
more
I thought,
appropriate ways.
exactly. I like that word,
Yeah.
that term actually, more appropriate. So if we turn this back now, and I think, the major reason for Shaz and I doing these type of shows is almost to unveil some of the things that healthcare practitioners almost take for granted that they think everyone should know. And as I said, lots of people don't know this, but if someone is considering coming for therapy with you, and they're saying, something doesn't seem right, is there anything that you would almost tell them, things to look out for? At what point would they actually start looking for assistance, with their little boy or their little girl?
Mm. Well, there's quite a lot of things that they can look out for. whereas the child will probably be able or be struggling with things like any new activity that they haven't done before. There might be, depending on the age of the child, there might be some developmental delays. A baby who hasn't started sitting by themselves yet at an age-appropriate time, or someone who, or a baby who hasn't started crawling by, let's say, 10, 11 months, they would need to start looking for intervention, or even just to have an assessment done. With school-age children, more the kind of child who's struggling socially in the environment or in the school environment, also the ones who's struggling with things like handwriting is quite a big sign that there might be some underlying difficulties there. So there's quite a lot of things or signs to look out for. And also to go on I must say, I give some credit to the teachers today. I think a lot of them have become more aware of sensory difficulties and are a lot more sensitive to notice and pick them up in the classroom. And most teachers today will be able to pick up if there's any difficulties and might make the necessary referrals for that. So it's also important to get that feedback from the teacher when they notice a difficulty. That's fine.
Yeah, I actually am really impressed that you've mentioned that a lot of teachers also start picking these things up. I mean, my aunt's a teacher, and one of the things that she said was, looking back at me when I was a youngster, obviously being dyslexic and whatnot, the first school I was in actually just didn't pick it up. They were like, the kid just doesn't want to learn, doesn't want to spell, doesn't want to write. And it was only when I got to grade 2 or 3 that a teacher said to the parents in a teacher-parent conference that although I'm smart, I seem to struggle with actually being able to write the word or read the word, and perhaps I should go and get tested for dyslexia. And it is amazing because not every teacher seems to pick it up, but I'm finding more and more that teachers these days are more attuned to those subtle hints from a child in the class. And they're not always subtle, but at least they actually picking up the cues and are able to say to parents, you might just want to have a look here or a look there. So I agree with you that it is getting a lot easier. But like Oliver said, I mean, when we were growing up, the kid who was running around all the time or acting out was kind of classed in that naughty category. And some of them are now adults that might not have had the help or intervention earlier. Is there interventions for adults suffering with sensory issues?
Yes, definitely. There's quite a lot of occupational therapists that kind of specializes in treating adults with sensory integration difficulties. Obviously, if you look in terms of equipment that's used, the equipment will be quite different to the ones that we use with a child. But a lot of the strategies and coping mechanisms are very similar. So there's definitely, and it's also a field in occupational therapy that started growing recently quite a lot, addressing sensory integration difficulties with adults. So there's definitely help for adults who's also struggling with that.
It's interesting. We've asked so many professionals around the same topic, Shaz. So maybe we should actually, start searching for an OT that specializes in adults, because that would be amazing, to have someone like that on board. But René, what you said, and again, as we speak, I start getting these memories. But I remember our little girl was probably 4 at that time, 00 or so. And the teacher, well, this friend of ours, I mean, his daughter, and I remember him telling me, no, she needs to go for OT. And that was the first time actually, put like handwriting plus OT in the same like basket. But it was interesting, hearing you say that as well, because it kind of brought back that memory for me. So what would an OT do for handwriting? How would you improve it? Because I do know that it's probably part of the fine motor skills that they probably need to learn. But how would you strengthen that, or how would you improve that?
Well, with something like handwriting, it's probably best to do a full assessment to determine what the underlying difficulties are. And if I can bring your attention back to the triangle that I've used as an example, So we would look at those sensory systems, because often we see that the two senses that do affect handwriting is our tactile system and our proprioceptive system. So the tactile and that feedback we get from our skin, muscles, and joints helps a child or a person to hold a pencil correctly. It needs to become automatic. So we would work on working on giving more correct feedback through those two sensory systems. We'll also look in terms of whether there's any motor planning difficulties, anything like midline crossing difficulties where the child might struggle to cross over the kind of the midline of their body. All of those kind of things would affect handwriting. And then obviously the fine motor skills. So we will also work on addressing and strengthening the hand muscles so that the child doesn't tire too easily and be able to maintain the correct pencil grip. Again, bringing it back to the sensory part, a child who's got difficulties with that proprioceptive system might be the ones who's really applying a lot of pressure on the pencil. So they would be pressing very hard while they write. And again, that tires them quite quickly, which results in deteriorating quality of the handwriting. So there's quite a lot of underlying areas that we would need to look at in terms of handwriting. So the occupational therapist would analyze the skill and see where the difficulties are, and then work on those specific skills to help and improve the handwriting. And then I haven't even mentioned things like the correct letter formation and things like that also needs to be addressed. So things like handwriting seems like quite a basic skill, but there's really a lot of underlying skills that's needed to be able to do handwriting effectively.
Yeah. And so it's interesting you say that, because again, when I go back to school, I mean, handwriting was such a big thing, like whether you wrote in, like print or cursive, and, cursive became a big thing in high school because no one wanted to write in cursive writing, but like, if I look at our kids at the moment, Kiara's going to go to high school next year, and, she's going to use a laptop, like they don't even, they're not even expected to write anymore. And I suppose, what I'm saying is that it's becoming less and less of a skill that they put so much of emphasis on. Kids have like iPads now, and it's almost, have you found that? I mean, or do you find that the schools still put a huge emphasis on handwriting?
Yes, especially primary schools do still put a lot of emphasis on handwriting, which I'm very glad about. Because handwriting teaches a child so many other skills that something like an iPad or a laptop just won't. Just working on the fine motor skills, again, that bilateral integration, using two sides of our body together during fine motor activities and during handwriting, where you need to support the paper with your one hand while writing with the other hand. So many skills that kind of gets lost when a child is just using a computer or an iPad. But there's definitely a place for all of those things, and it's something we need to get used to, because that's our lives today. But it is important for a child to still be able to do proper handwriting so that they will be able to read someone else's handwriting and be able to fill in forms that can't be done electronically. So even though looking in future where computers and things like iPads will probably become more and more used during our daily lives, handwriting is still one of those things that teaches us so many other skills that a computer just won't be able to do.
I actually think that's phenomenal. We take it for granted now because we all use laptops and so on, but just how important something as simple as handwriting could be in the developmental stages of a person. Is there anything else along the lines of, handwriting or stuff that children tend to do in primary school that plays a major role in being able to see some of the other potential sensory issues that a child could be facing? Handwriting, as you said, can be from a result of quite a few different points in the bottom of that triangle that you would have to assess and see. Is there anything else that, as an OT or as a teacher, that one would look at to kind of go, maybe there's a sensory issue here?
Yes, look, if we look at all the areas of our development, all of that can be affected by sensory difficulties. So just taking an example like the posture we use while we're sitting at the desk. For us to be able to use our core muscles, our tummy and back muscles, we need to be able to get the correct feedback from our movement and our proprioceptive system. So children who needs a lot of movement input during the day is probably not getting the correct amount of movement during a high school day, for example, whereas in the primary school, they still get a lot of that. So a child who's really tiring quickly and don't have a very good muscle tone in order to be able to maintain an upright posture need a lot of movement breaks during the day. So that's why recess and breaks during the school day is so important for the children to be able to get that movement input, which activates the core muscles again so that they are able to maintain an upright posture for longer. So that's just one example. A child who is struggling to learn age-appropriate gross motor skills like skipping and jumping and hopping, being able to balance on one leg. If a child shows difficulty in many of those skills, it could also indicate sensory integration difficulties. And then, like I've mentioned before, just a child who's very sensitive to certain input. It could be a child that's sensitive to auditory input, so they might struggle in the classroom when there's a lot of noise and things happening. They might be the ones covering their ears or kind of get irritated quite quickly and then present with kind of a meltdown or a tantrum, and they might actually just be more sensory underlying difficulties. So any kind of difficulty in any area of development might be an indication that sensory integration therapy is needed.
That is so useful. So I was like adjusting my posture because I'm terrible with it.
It's like, funny whenever I talk about posture, I see everyone
like,
straight
yeah. So I go to physio and like, the physiotherapist always keeps on saying, like everything comes back to posture. And, like I did software development, I still do. And I almost have to set a reminder, to actually go stand up and go do something else because you get stuck in it and you get into that zone. And then like 2 hours later, you're still busy on your keyboard. So you don't normally like sit to do this, but I think what you're saying is it's so important to be aware of it and constantly almost like creating the space where you like you said, the recess, for me that recess is that alarm clock going off and saying, okay, you have to go get something just to get out of that hunched position. So if a parent is coming through for you for therapy, René, what can they expect in therapy? And is there a certain duration normally that you work with or that you typically work with your clients?
Okay. So when a parent contacts us initially for an assessment, there will usually be like a short interview over the phone just to get a background history of the child and what their specific difficulties are. And then the child will most of the time undergo a comprehensive assessment to get a better understanding of the child's strengths and weaknesses. So this will include looking at all the aspects of sensory integration, as well as how the sensory processing affects other areas, such as planning and coordination, all their fine and gross motor skills, as well as visual perceptual skills. These will all be done age appropriately, of course. Observations during the assessment is also important and will be done during formal and informal activities. So that's why I don't know if parents always expect the assessment to involve a lot of play, but during play is actually where we see a lot of the child's strengths and weaknesses coming out. So a lot of the activities in an assessment will be informal as well. The therapist will usually then prescribe some activities or sensory activities to do with the child during the day. Some parents might have heard the term a sensory diet, which it doesn't have anything to do with food that the child eats, but it includes all those sensory activities that can be included in their daily lives, like things that can be done during the bath time or while they're driving to school, things like that. So once the assessment once the assessment is completed, the parents will usually be called in for a feedback session where the therapist will give a comprehensive feedback of how the child has performed in the assessment. And then according to whether therapy is indicated or not, the therapy sessions will start, which can range from one, two, or in some cases, even 3 sessions a week. It's important to note that the therapy will be done in a room which is quite large, just so because we use a lot of equipment to be able to provide all those sensory activities in a safe environment. So the goal is to involve as many senses as possible. And the most important thing with children is they do learn better during play than just doing an activity for the sake of doing it. So the therapy that will be done will be very child-directed. So even though the child has the ideas of what they want to use and games they want to play, the therapist will analyze the activities and adjust it accordingly to be able to reach all the goals. And just coming back to your question on how long the therapy will be done, that's really a hard one to answer because every child is so different. So it will really depend on the child's age and the severity of the difficulties, how long they will be in therapy for. We usually do a reassessment after at least 6 months of continuous therapy to be able to reassess to see what progress has been made and how and what area still needs to be addressed.
That was amazing information. I mean, I always say that the physios and the OTs, that deal with children, obviously, I mean, they have the coolest rooms because, I mean, the kid just goes in there and there's all of these, what we as parents see as toys, but, like obviously it has a very, beneficial use. And but yeah, kids love that area. Hey, I'm sure you find that with your patients as well. I mean, they love coming for therapy.
They usually love coming for occupational therapy. We rarely have someone who doesn't want to come for their session. And like I said, it looks like they're playing most of the time, but every activity has a specific reason that we do them, and we include all our goals into the activities that they do. But play is so important because it's actually the child's occupation is to play, and that's where they learn most of their skills through.
Yeah, I know our little boy didn't want to go on a swing for a long time, but I mean, I still have a photograph of him falling asleep on the swing. That's how accustomed we got to it, towards the end.
Yes.
But so 2 points, and then I think we can probably wrap it up. But my first one, I was really interested in that point around the sensory diet part. So is that something that you would put together for your patients? This is the sensory diet, and these are the activities that you would normally go through. Obviously, the parent would get that to go through with the child. And then my second question was, from an assessment point of view, would you recommend like a child going through, because we live in a world where, I mean, things just happen so fast. I mean, as parents, it's so difficult to keep track of things. So do you almost recommend, how you do your medical every year or every 2 years, do you recommend something like that for a child? So just as a almost like a status check of where the child is, where are they with posture, where are they with this? I mean, is that something that you see in practice a lot? I'm just asking again as a curious parent more than anything else.
Okay, I'll answer your second question first. Occupational therapy is quite unlike a medical examination or going to the dentist where you have to do a checkup at least once a year. If a child is functioning normally and there's no concerns or no difficulties, they're able to do everything that's expected from them at that age, I wouldn't say it's necessary to have an occupational therapy assessment done. Obviously, if there are any concerns coming from the teacher side or something the parents pick up at home that they might be concerned about, it's always a good idea to contact an occupational therapist and have a discussion and see whether the OT thinks it's necessary to do the assessment. But it's not like I said, going to the dentist where you have to do it at least once a year. It's not really the same kind of thing. And then your answer about the sensory diet. The sensory diet does consist of quite specific activities that's chosen for each child individually. So let's say a child who's really needs a lot of movement during the day. Again, a lot of activities will involved around that then. Things like taking breaks during the school day, being able to go outside, run around a bit, or go onto a trampoline for a few jumps for a few minutes, things like that. And just looking at things like our proprioceptive system, that's usually the system we use to try and self-soothe or to help and regulate and calm our bodies. So a child who needs a lot of input like that would have activities such as jumping down onto a lot of pillows at home, which gives him a lot of that deep pressure input. The parents can also kind of squash him with a pillow or with a therapy ball all over his body just to help with that regulation and the deep pressure that his body needs. We try to include the activities so that it can be done during their normal daily life. So while the child is driving to school, we can suggest he plays with a stress ball or with a piece of plastic or even with a paper clip, which all that movement with his fingers also gives him a lot of deep pressure. Even during bath time, they can pour water from one container to another. All of that also gives them a lot of deep pressure. But like I said, it's very specific for each child, depending on their needs and what they are required to do during the day.
Okay, that's amazing. But what I'm hearing you say is that you definitely formulate something like that for each child that they, the parent can go through or could monitor, which is amazing. That's actually really cool. It's the first time I've heard of that. I do know exercises, like they normally say, you can do these exercises, but I don't think I've heard of the term sensory diet, which, that's amazing to learn that. We're going to wrap up now. Shaz, anything on your side that we missed? And then René, on your side, if you can think of anything that we missed, that we should have asked you, but we didn't around this topic. And then, we can wrap it up.
Just the one question that has come up a couple of times in just people that I've chatted to. Would sensory integration or sensory processing disorder be considered a genetic thing? So as an example, I know invariably if there's a couple of people in the family that have ADHD or that have some level of depression, would sensory integration fall into a similar type category? If grandpa was tactile, overly sensitive to tactile input, is it possible that a grandchild or a great-grandchild would then also potentially have sensory issues?
Okay, so there's no definite known cause for sensory processing difficulties. Children can have a genetic predisposition to having sensory processing difficulties, but it's also often caused by the interaction with the environment. It can also be due to deprivation or trauma. But I must say that many of the children we do see in therapy do not have any of the above mentioned scenarios in their history. So it can then basically be described as an immaturity of the nervous system. There are neural pathways in the brain that communicate the sensory information to the brain. And a lot of the times these pathways are just not fully developed yet. As an example, a child at 18 months who's not walking yet will go to physiotherapy who will help teach the child to walk. Just like that, an occupational therapist will help the child to develop those pathways to assist with sensory processing. So sensory processing difficulties might have a genetic component, but it's not the only known cause for sensory difficulties.
Okay, that's actually really good to know. So René, on your side, anything that we missed from our conversation?
No, not that I can think of.
Okay, then that was good. I think this will become a really good resource then, for sensory integration disorder. That for anyone that's looking at it or hasn't come across it before, I think would be amazingly beneficial. Hey everyone, thanks for listening. As always, stay tuned and we'll speak to you in the next episode.